Thank you, Governor. Good afternoon, everyone. Thanks you for joining us today. I'll get started with the data. We have 84 new cases of COVID-19 to announce today. In addition, there are currently 141 people with COVID-19 in the hospital. Of these 141, 28 are in the intensive care unit, and 17 of those 28 are on a ventilator in the ICU. Sadly, we have 10 additional COVID-19 associated fatalities to report today. Each of these lives matter. 3 of these people were in their 60s, 3 of these people were in their 70s, 1 of them was in their 80s, and 3 of these people were in their 90s. Reporting these numbers every day, every week, continues to be very difficult. Our hearts and sympathies go out to families and friends of these precious Rhode Islanders who we have lost. That information motivates us to continue to do our best to stay in front of COVID-19. In terms of our number of new cases, we continue to be in a steady, good place. One of the reasons why we have been able to achieve that is because of our aggressive approach to testing. As we have outlined, we have a 3-pronged approach. The first strategy is testing everyone who has symptoms, which we've been doing since the beginning and will continue to prioritize getting them tested, identified, if they are positive, into isolation, and also contacting the people who have had direct close contact with them so that they could be quarantined and monitor themselves for symptoms. That is the primary way for us to stop transmission of this virus. The second strategy, as the governor shared, is the Outbreak rapid response that allows us to really be aggressive in settings that are at higher risk, such as the congregate care settings and in communities of color or communities where the population is more dense. That way we can really wrap our hands quickly around a place where there may be a case and identify if there are any more before it becomes too big. It helps us stay in front of what's needed. Finally, our third strategy is the Sentinel early warning system. As the governor just shared, we announced earlier this week that we opened COVID-19 testing to people in certain high contact occupations. And we thank you and encourage you to get that test because it does give us more information about people in high contact occupations in a way that can be helpful as we're moving forward, reopening the economy. It's extremely important that our priority continues to focus on the communities being hardest hit across each of these 3 elements of testing, including the Sentinel early warning system. We want to make sure that we're offering testing to people who are from communities of color, and we're continuing to do work to offer testing in those communities so that it can be accessible for asymptomatic testing to occur and help fully inform our Sentinel early warning system. The health of people in the communities being hardest hit and the health of the entire state depends on our ability to get resources into the communities that are most impacted. We are working hard, but the reality is that we are still seeing the disparities when it comes to COVID-19 in Rhode Island, and it's clear to us together that there is more for us to do. So we want to emphasize that as we are encouraging high contact workers to get tested, we specifically want to make sure that people who are from communities of color respond to that and know that in the coming weeks we're working on getting that testing even more accessible to you in those communities. We've also seen disparities when it comes to serology testing or antibody testing. Many reporters joined Dr. Phil Chan earlier today. He is one of the consultant medical directors at the Rhode Island Department of Health on a call to discuss serology testing. As you may recall, we randomly selected 5,000 households from all over the state and mailed letters offering voluntary serology testing at one of several Stop and Shop locations throughout the state. Serology testing determines whether someone has antibodies for a virus, indicating whether they have been previously exposed to that virus. Thanks to our COVID-19 testing and validation task force, we have more information that helps guide us as we're interpreting serology testing. The entire nation is learning, but because of the experts we have, we can slowly understand that using these serology tests to help us understand the landscape is a helpful tool for us. We also still know that it is not yet ready for interpreting test results on antibodies at an individual level. We have learned, based on the results, that COVID-19 seroprevalence for Latino Rhode Islanders is roughly around 8.2%. So that means 8.2% of the Latino Rhode Islanders who were sampled and received the serology test seems to have been exposed to the virus based on the results of the test. Similarly, for African American Rhode Islanders, it was 5.2%. The disparities are present because we understand that for all the Caucasian Rhode Islanders who were sampled, the seroprevalence was roughly 1%. So it's clear that a lot more work must be done when it comes to disparities, and it's what we are all laser focused on together with the governor's leadership. The important overall picture from the serology testing that's helpful is that for all people sampled, 2.2% was the number of seroprevalence of people who showed a positive serology test result when you look overall. So that's comparing the overall number and then also being aware of what happens when we look by race and ethnicity. One of our operating assumptions throughout this response is that there are a number of additional people who are COVID positive that have not been tested as of yet. So with that working assumption, that 2.2% number that we have is relatively low overall. And we can look at the data also to learn how to help assist in areas where we're seeing the differences in the numbers. Another important point to make is that there's still a lot we're learning about COVID-19, and that's why it is very helpful to know we're one of the first states to have done this type of statewide assessment. We don't know yet whether COVID-19 antibodies will actually be protective against COVID-19. So this information allows us to help learn a little bit more. It's valuable, but we still have that caveat in place, which is why it's not intended on an individual basis, but to continue to help us assess at a population level. So I want to finish with thanking all of the people who worked very hard to coordinate this statewide serology testing effort and to do the data analysis. In addition to Dr. Phil Chan, whose expertise has been a huge asset for our response in Rhode Island, I want to also thank our tremendous state's COVID-19 testing team, who really worked hard in a short amount of time to get this activated and to get us towards the results we're able to learn from. We also have wonderful partners at the Brown University School of Public Health that we are grateful for. And then finally as well, our Brown University Policy Lab, all working together to help us learn more and keep Rhode Island at the forefront as we're going forward.